everyone. My name is Dr. Jaqueline Yang. I'm a naturopathic doctor and acupuncturist. And today I'm going to be talking about thyroid and your body, a more holistic approach to treating the thyroid. I'm just thinking and going back into my childhood, I always wanted to be a doctor, but as I was growing up, I saw a lot of loved ones who weren't getting good care. And so as I just developed and learned more about medicine science and also even the aspects of food as medicine, I decided that conventional medicine wasn't quite what I wanted to do. And then when I found naturopathic medicine, it was no question about it. And so I packed up my bags and I moved out to Arizona and just did it. I just became a naturopathic doctor and I love it. Then I think this is one of the more interesting parts of this talk is to understand that connection between your thyroid glands and other areas of your body. And then I thought it'd be helpful to include some things to talk to your patients about, including those diet and lifestyle tips. And then also what's really important is managing stress with your patients and making sure that they have or are thinking about learning some tools and techniques to manage their stress. So some common conditions of the thyroid are essentially either low or high. So you have low thyroid dysfunction or you have high thyroid dysfunction. And then in terms of the terminology of hypo, hyper, we also though have a euthyroid situation where it's sometimes termed as subclinical hypothyroidism. Okay, so here are some nutrients that are important for your thyroid. And this is really helpful because this goes into diet, not necessarily supplements. I try to encourage my patients to get as much as they can from their diet. And then if they have a hard time or they need a little bit more, then that's when I go to supplementation. So iodine, think about the ocean, the sea. So even seaweed, right? Whether a person wants to snack on those dried seaweed, the nori, or you're putting kelp, as a base into your soup. Kelp actually provides a lot of iodine, so about 2,000 micrograms per gram. Fish and seafood, they're in the sea, they're in the ocean, so they're going to have some iodine as well. Although the iron in there is iron in there, it can be harder for our bodies to absorb. So if you have a vegetarian or a vegan who is iron deficient or who needs more iron, just encourage them to kind of pair it with something that has some vitamin C to help them with that absorption process. And then you do want to, though, monitor iron levels just to make sure that, if they're not getting enough from diet, then you may need to supplement. And then vitamin E, which is in your almonds, raw seeds, dark green leafy greens. I do take caution in supplementation because it's really important to make sure the form of the vitamin E and the quality of the vitamin E is high. Because if you take the wrong vitamin E, then it can potentially be pro-inflammatory as opposed to anti-inflammatory. So you do want to be careful with that and see if they can get enough of it in their diet. Another thing to note is vitamin A and E are fat soluble. So you want to make sure that they're having a fat while they're eating those foods so that their body can absorb it. The connection between the thyroid, celiac disease, vitamin D, and iron. From this paper, it showed that low vitamin D levels were found, more frequently in patients with new onset autoimmune thyroid disease. And because of that role in the vitamin D and the immune system. And then there's also an inverse relationship of vitamin D and anti-thyroid globulin antibodies. So meaning if you have low vitamin D, that could potentially lead to higher levels of those thyroid globulin antibodies. And here's a table or figure that sort of gives you a visualization of that connection. And what to ask your patient, just some things like, when was the last time your thyroid was checked? Because sometimes on routine and annuals, thyroid isn't checked. Also, particularly when the person is younger, for some reason, sometimes the thyroid is not looked at. So I hope that was helpful. I know I probably went through a lot of information. Thank you for the opportunity to share with you what I know and what I've learned through my clinical practice. And I hope I can talk again soon. But everyone have a great day. Thank you.